I'm Lauren Goodman with GoodSkin Clinics. Thank you for watching. This is Casey Welk, and today we're going to talk about filler nose job.
We have a lot of patients who come to us who want to make subtle changes to their nose. They want to know, is surgery best? Can we use filler? So we diagnose our patients to find out if a filler nose job is a precursor to surgery, or if we're going to do it as an alternative to surgery. But diagnosis is very important. Stay tuned.
Hey Charlene, so the first step before we do any treatment is diagnosis to make sure that you're a good candidate for the filler nose job. So I'm gonna run you through your Vectra and we're gonna basically diagnose what kind of filler nose job results you can expect. Okay, you ready? Okay. So your concern is that you basically would like your nose to look not as droopy, right? Okay, so your diagnosis is that you have a slightly downturned nose, and then from the side, it's a little bit, we have a lack of a bridge, nasal bridge right here. So your diagnosis is that basically you need more support right here, and then I'm gonna use a little more support here to turn the nose up. We're going to use a filler that's appropriate for the nose to give you, again, a little bit more of a bridge. So your diagnosis is basically that you need a little more structure. Does that make sense to you?
Yes.
Okay, so if you told me that you wanted a much smaller nose, your diagnosis would be different. Your diagnosis would be that you wanted to bring in all the structure, and that's a situation where I would say a plastic surgeon would be more appropriate for you. But because you're wanting to make it just more straight, we can absolutely achieve that with a filler nose job. Do you have any questions, fears, concerns before I start?
I read online that there is a risk of blindness when you get injections in that area. Can you explain that to me?
Yeah, I absolutely can. So for anyone watching at home, I do recommend going to an expert clinic because this is an area that does carry more risks. There's more risks because there is an artery that feeds the eye, and it basically starts down and runs up through here and can cross the nasal bridge here. Now, in your situation, I'm actually going to be treating you down here, so I'm away from all the risky area, so you don't have to worry about risk of blindness. But there are some instances where I do have to treat in a risky area, and then as a practitioner who's an expert in anatomy, I actually take a number of steps to ensure your safety. So for anyone watching at home, like I said, look for an expert clinician who is an expert in anatomy before you have anyone touch your nose, because it is a more expert area to treat that does have some extra risks. That said, like I said, we're gonna be in a total safe zone today, and so you're gonna be just fine. But thanks for asking, great question. So with Charlene's nose, it basically tips down a little bit. I'm gonna have you move your head a little to that side. Perfect. And go ahead and smile for me. Smile really big. So basically, especially when she smiles, her nose tips down. So the filler is actually gonna be used to create a new bridge for her. We're actually gonna use a little bit more of a structural filler versus a very soft filler because I actually need to give the illusion that her nose is tipping up. So I'm actually gonna make her a new bridge with the filler. And again, we're actually in a safer area. We're not going anywhere to the sides. That would both be considered a danger zone. This would be another danger zone, and I actually don't need to inject her here today. She's gonna get a great result by me just injecting her from here down.
So Charlene, because like you mentioned, she didn't like how the tip went down or that it moved when she talked, we needed to make the tip of the nose a little stronger. So obviously we diagnosed that we could possibly do that using a filler. She wasn't asking for the nose to be much more centered. She wasn't asking for a much smaller nose in relation to her face. So with those concerns, we were able to diagnose that, yeah, she could handle a filler nose job. What type of filler did you guys use?
So it's important to use the right filler when doing any technique. For this particular procedure, the filler nose job, we want something that's a little more structural. So Lisa, when she was treating Charlene, she mentioned she was building more of a bridge of her nose. So you want something with a little structure. So we used that staying midline in order to build that bridge for her.
I know that I've put filler in my lips before for hydration. Could I just have used that filler?
Nope, very good question. So with the nose, and with Charlene in particular, we were working on building bone, the bridge, collagen. But with lips, we're working on fat. So there is difference in firmness between those two parts of the anatomy, as well as those different types of fillers. So for more structural parts of our anatomy, we're gonna use more structural filler. For softer parts of our anatomy, like our lips, we're gonna use a softer filler. With any of our procedures, we wanna make sure our patients are comfortable. What did Lisa do during this particular procedure with Charlene to make her comfortable?
Well, a couple things. What's really great, filler has numbing in it. So while Lisa's injecting, the client is already going numb. And what's also really great is the nose is not that painful. So Lisa applied topical numbing for about 20 minutes, and then we gave her a little bit of a vibration device to help distract, and then a little squeezy ball. She did great.
She did very well, yeah.
Okay, so I just finished Charlene's filler nose job, and as you can see, she has already, her nose is more tilted up, and I want to show you guys one of the secret sauce that I did. Go and smile, Charlene. Is that her columella hair basically needed more support. So I actually treated her right here at the tip of her nose, down here, so that when she smiles, it doesn't collapse. And it's fascinating, you can actually see that the nose is more straight. She's got these she's already swelling just a little bit, and we're actually going to see her back for a follow-up and put a little bit more. I'd say a lot of people think that a filler nose job is one visit. I think best results are usually with 2 to 3 visits, because you're basically building someone a new structure and you want to be able to layer it. So, but let me just show the camera. Cool, she's already much straighter and slightly tilted up. So there we go.
The nose can bleed a little more, so we try and prepare patients, set their expectations, but we asked her to ice the area, and we scheduled a follow-up with her. We set our expectations, letting her know that it's not a one and done technique, that it generally takes 2 sessions, so we made sure that she kind of understood that. Quite often, if we're trying to speed up any recovery process, we use growth factors that we can put on topically. So there are a few different product options for this, and so she's going to be applying that for the next several days to really speed up her recovery process.
That's incredible. The results are actually subtle. That's what we were after, especially with our filler nose enhancements. We're actually after making small adjustments to the nose that are not surgical. A filler nose enhancement is a great way to sometimes try on a change to your nose before you have surgery. Now, it isn't for everyone. It's not for someone who's wanting to make their nose appear drastically smaller. But if you're looking for subtle changes, whether it's you want your nose to be a little straighter or a little more turned up, or to have the appearance of being a little more narrow, those are all things that a subtle nose enhancement can take care of for you before you decide to have surgery.
So it's been a month since my filler nose job. The first couple of days it was pretty red. There was still a little blood on the afternoon after I got the procedure. I was a little bit nervous about the redness going away. I did contact the team here at GoodSkin to make sure that it was normal, but it's been after about a month, the redness has gone down quite a bit. It's still a little bit there, but it's easily covered by makeup. But I'm pretty happy with the results. It's subtle. When I smile, I notice that my nose doesn't droop down as much, and I see that it holds its shape a little bit more, and my profile looks a little bit better. Primarily, I noticed that as I was smiling, and I feel like as I was getting older, my nose was drooping quite a bit more than I was used to seeing. And so I just wanted to see if there was anything that I can do to kind of prevent it from doing that. It was super simple. The procedure was painless practically. You know, without seeing any of the redness, I probably wouldn't have noticed anything at all. But it was mainly just the redness and the swelling that was that I noticed, but no pain other than that. I wouldn't say that anybody has actually noticed, but I prefer that, so I'm happy that nobody's noticed. I just wanted to look like myself just a little bit better, like more like how I remember myself looking when I was younger.
So thank you for joining us for Charlene's filler nose job. She looks beautiful. I'm so excited to see the results in a couple of weeks.
Please drop your comments below. Don't forget to press subscribe, and we hope to see you in the office soon.
See you very soon.
Bye.